Your genes hold the answers to your family's overall health. I'm Dr. Paula Krupstad, and on the Get to the Root with Hope for Healing podcast, I sit down with experts in genetics, functional medicine, and family care to explore what's really going on beneath the surface so you can stop guessing and start healing. From personalized insights to practical tools, we bring you whole family wellness that starts at the root. Welcome to the Get to the Root podcast. I'm your host, Dr. Paula Krupstad, and joining me today is Dr. Cheng Ruan. Dr. Ruan is a board-certified internal medicine doctor and the founder of the Texas Center for Lifestyle Medicine. He's an advocate for developing integrated business models and patient-focused communication within private practice settings. He's also an advocate for collaborative medicine and has developed community programs in Houston anchored in health coaching. Dr. Ron completed his undergraduate degree at Texas A&M and completed his medical degree at Ross University School of Medicine, went on to do his residency and chief residency at New York Presbyterian Queens Weill Cornell Medical Center. Thanks for joining us, Cheng.
I'm so excited to be on. Thank you for having me.
Yeah, so we're going to be talking today. The title of your talk, and this is so many people ask us about this, is Demystifying Ehlers-Danlos Syndrome, POTS, and Dysautonomia. So I'm excited to ask you these questions and learn. And every time I do one of these, I learn something new. So this should be fun.
Yeah,
All
absolutely.
right. Well, it feels like we really are hearing about the term EDS everywhere. And is there actually an explosion of this condition, or have we just been misdiagnosing it as general chronic pain for decades?
The latter.
Okay.
What's happening here is that Ehlers-Danlos syndrome, I mean, when I was in medical school, it was like this one blurb, this picture of the person with stretched skin, and that was it. And I was on the boards, and that was it. But it's far more complex than that. And I don't think I even knew what it is, nor did I know I was married to somebody who had it. And her being a physician too, right? And it's not until I saw there's a much bigger picture than that. So in trying to discover sort of this EDS and association and everything, I start realizing that looking at members of my family, my wife and her family, they're people who are hypermobile, who are predisposed to certain things, infections and mold toxicity and Lyme and all sorts of different things, right? And I started looking at patterns because one of the things I do is brain mapping, which is quantitative EEG, and they all have a very similar quantitative EEG pattern
Huh.
with something called attentional hypervigilance, which now I know is actually a sensory hypersensitivity. So they absorb senses. So light, sound, everything is a lot more for them than the average person. And so in our current culture, that's called neurodivergent, right? Some sort of neurodivergent profile. And so I started noticing that a lot of people with a hypermobility are diagnosed or labeled as neurodivergent profile. It could be ADHD, it could be ASD, AUHD, et cetera, right? And so now the patterns are starting to click. And then I got trained in functional medicine. And that kind of exploded everything because looking at bodily functions, now we're able to connect more biomarkers and chronic inflammatory response markers, and then connecting that with like EEG patterns, we're able to see that, oh, there's a lot more to this than I thought and a lot more to this than I was taught. And when I talk to other doctors about it, like that's not a pattern that other doctors usually see. And so
Yeah.
I think we're discovering it more now because we know about it more now.
Now, on the EEG, you said it's attentional hypervigilance?
So hypervigilance means that our body conducts electricity, especially our brain and heart. So when we look at probes and sensors on the scalp, we're able to sense different frequencies. So when you're in attention, you're in, let's say, like 12 hertz or 14 hertz, which is, the squiggly lines on the EEG. And then where you're in hypervigilance, you're at like 20 hertz and 22 hertz. So that could be excitement, anxiety, it could be brain fog, it could be fatigue, it could be all sorts of different things there, right? And
Okay.
so now, when your brain is in high frequency, exhibit those symptoms. When your brain is in low frequency, such as 4 hertz, it's exhibit the exact same symptoms. So the brain fog and fatigue and attentional deficit and stuff like that. So most people with, let's say, attention deficit disorder have a lower frequency issue, but those people with EDS tend to have a higher frequency issue is because there's nothing wrong with their brain per se, but there's no filter coming in. And so they're
Okay.
absorbing all the senses. So they can sense mold, they can sense Lyme, they can sense infections, but they don't know they're actually sensing it. So a lot of times they label themselves, oh, I'm just making it up or crazy or something like that.
Mm.
And that doesn't feel very good. Yeah.
Yeah. So, for someone who's listening who feels like they're just falling apart, but they look fine on the outside, what are the three weirdest signs that they might actually have EDS?
All right. Number one, TMJ dislocation. That's a huge one. A lot of times, your TMJ, which is the part where your jaw meets your skull, can hurt or sometimes get stuck. Super, super common thing. So usually I ask people, if you're in the dental office, does your jaw usually get stuck? Okay. And these are people that hasn't had any sort of facial trauma or anything like that before. Now, mine gets stuck because of martial artists, but that's a different story. By the way, everything is in head and neck. Another one is if you put your head forward like this and then flex your neck, and then after a while you find it really hard to breathe, and then you may feel wanting to pass out. That may be because the way your head and neck position is actually affecting the blood flow to your brain. And
Okay.
oftentimes the spine will actually split forward, called subluxation, and that is a component of what a lot of people have in EDS, which is called cervical cranial or cranial-cervical instability, CC.
Okay.
And the last one is simply swelling. If you get swollen like randomly, and then it kind of goes away, and then you feel better, it gets swollen again, like super, super random, and then you have flexible joints at the same time. Like that's another like weird one that people don't really talk about. But those are basically your body sensing something is wrong, releasing massive amounts of mast cells, which release histamine, and that's what's
Mhm.
actually happening. It's up and down of histamine that happens.
Okay. Wow. Now, we often think about being flexible as a good thing, like a yoga superpower, but when
Yeah.
does the flexibility cross the line into EDS, and why does it cause so much hidden exhaustion for patients?
Yeah. This actually has to do with teeth. So let me kind of explain.
Mm.
So the way that our jaws are formed in embryology, our front four teeth are the same embryologic origin as nerves from neural crest cells. So in embryology, as our face develops, it actually wraps around from the back and then going forward and meets in the middle. Okay. And then when we're born, we're supposed to be challenging our jaws with, let's say, solid food. Okay. Starting at, let's say, 4 months old. And then that stimulates gene expression, our epigenetic expression to allow the jaw to deploy laterally. Okay.
Okay.
That doesn't really happen in people with EDS. And so pretty much everyone with EDS does have a hard time deploying their jaws laterally, and therefore they have a very like steeple palate. It's really high, or sometimes they have tori, which are little bumps at the top or the bottom of your. And when that remains high, when they grow up and through puberty, there's no chance for that top palate to come down, and they develop deviated septums. Okay, because the
Okay.
septum never got pulled down, never got pulled straight. So what happens then? A lot of people with EDS, I was like, show me your teeth, is because they kind of look like almost like buck teeth a little bit, where they have it appears to have larger front teeth, but what's happening is that they actually have a narrow jaw, and sometimes the incisors are like retracted upwards, and they didn't have room to really come down. So
Okay.
what happens then is that they don't have a great bite. So there's this nerve in our maxilla mandible called the trigeminal nerve, and it sends signals to this part of the brain to moderate the vagus nerve. So their jaw cannot activate the vagus nerve. And the vagus nerve's job is, reps and digest and stuff like that. So they have a really poor, like, vagal tone, which affects their immune system, the gut microbiome, and histamine, and mast activation, and all the stuff like that. And so that's a really common cause. Mhm.
Okay. Now, where did you learn all this about EDS? I mean, we're not taught this in medical school.
Yeah.
And then,
Yeah.
where did you take the deep dive in to learn all this? I just love learning this with you. You're teaching me.
Yeah, so I was lucky to make friends with dentists. There's a very famous one. His name is Dr. Felix Liao. He kind of introduced me to this concept. And then if you actually look at international, like POTS and EDS forums, like the Zebra Foundation, the UK, and stuff like that, this is actually really well talked about. In fact, I accidentally ran into that because of Support Fibro, a beautiful nonprofit organization that's run by a functional medicine nurse and health coach. And fibromyalgia is very similar, where there's underdeveloped jaws, and then sometimes there's bite abnormalities, and the trigeminal nerve never gets a chance to activate the vagus nerve, and there's a lot of pain associated with it. So most people with EDS have some form of that if there's pain in the head and neck, right? And
Okay.
so that took me to a study that was done it was actually done on patients with motorcycle accidents with jaw fractures, and there's specific alignment issues that puts them in chronic pain for the rest of
Mhm.
their life, just like it's fibromyalgia. And they develop POTS and dysautonomia, like severe after the facial fracture. So that publication came out in 2012, and it's called the TCR, the trigeminal cardiac reflex. So I looked at that, and then I looked at the EDS population, and kind of put the two and two together. So now we're working with dentists that specialize in EDS to do oral appliances that align the teeth together, and they titrate to their spine and their hip and the pelvic floor, and then that actually regulates their nervous system.
Do some of these dentists use an ALF?
So alpha is one of the epigenetic appliances. The answer is yes, but there's other different ones as well.
Okay.
This is really individualized because sometimes you can have some of these appliances and people with EDS will actually get worse. It's because
Mhm.
it's either too much or the stimulation didn't allow the palate to regulate, and then the vagus nerve just kind of freaks out. And so it's very like small changes that the dentists like actually do, right? But there's different types of appliances. So the term epigenetic appliance for the people who are listening means that there's appliances that stimulate the jaw. So it uses the body's own mechanisms to create gene expression called epigenetic gene expression to allow formation of different systems, the teeth and the palate to regulate. And when they regulate, the body comes into sync.
Beautiful. And then you're capturing this too. You can look at their brain scans and kind of see when things are calming down a little bit.
Yeah, I'm actually presenting that at Miami this year, surgery conference, is that we can actually before and after when people get their appliances done and they kind of regulate their bite, what that actually looks like. Another big deal is called cranial torsion. This is something brand new I'm discovering. So cranial torsion is when and there's a lot of people with EDS that if they look in the mirror, they notice some significant like asymmetries. Maybe one eyebrow will be higher than the other, or the shapes of the nose and stuff like that. That's a really common thing in EDS. And so what happens is as they grow up, because the palate didn't fully widen and the bite force is different, their cranium, the skull actually rotates a little bit. It's called cranial torsion.
Mhm.
So that contorts the shape of the sphenoid sinus, and the sphenoid sinus is like a hole that's in the skull that connects to the brain that's supposed to be there, and it's shaped like a bat wing. But the bat wing starts torsing, and when the bat wing starts torsing, it's hard for you to get air up into there and to make nitric oxide. And when you deplete nitric oxide, that's called POTS and dysautonomia.
Mm. Excellent, excellent. So why is it that EDS patients often have perfect blood flow and normal MRIs, yet they feel like they've been hit by a truck every morning?
Yeah, because their MRI is laying down. The MRA is laying down. When you lay down, it's perfect. Everything's great. You feel pretty good. But the minute you get up, it's not. This is why we send people for upright MRIs or extension flexion MRAs, and they're radically different. Yeah.
Oh my. Wow.
Yeah.
So you've kind of alluded to this when you talk about the sphenoid sinuses and then that cranial
Yeah.
torsion, but many
Yeah.
people with the EDS describe a heavy head or brain fog that makes them
Yes.
feel like they're living underwater. So what is
Yes.
actually happening to the brain circulation in that hypermobile body? You've given some hints toward
Yeah.
that already.
And I think this is the most important part of the podcast, so please listen to it, people. In order for the head to sit straight upon the spine curvature has to be a nice, like, backwards S, right? And so if that S gets straightened, then what happens is the head, instead of being, 8 pounds, it would be 4, it's gonna be like 36, 37 pounds. So what happens is, in a lot of people with EDS, because the palate hasn't been fully developed, the weight that also narrows their windpipe, right? Their airway. So when airway is narrow and when people with EDS lay down, it can actually collapse inwards. So
Mm,
in order for them not to die, the curvature of the spine naturally rotates forward, and it strengthens this muscle called the sternocleidomastoid and the anterior scalene, like literally pulling everything forward. It's like a forward rotation. The problem with that is that the head is heavier, so you're using more force, and then on the back, you have to have a counter traction on the back. So that's why they get a lot of headaches, like around this crown of the head, all the way to the back to the nuchal ridge right here. And then they have like a lot of photophobia, which basically like any light that comes in, if they have to squint like this, their crown of the head is already tight, just trying to maintain a normal posture in the airway. And that creates sort of these migraines and headaches and cluster headaches and stuff like that.
Yeah.
And then on top of that, if the head is forward, that means that there's a fascia, it's called the great fascia, that connects the tongue all the way to the diaphragm, all the way to the pelvic floor, psoas muscle, all the way to the feet. And everything's contracting forward. So the diaphragm gets trapped and they have a hard time breathing. Okay.
Yeah.
And then the hard time breathing, the pelvic floor has to rotate and tighten inwards. So a lot of them have like pelvic floor issues. And that pelvic floor rotates inwards. And then they have issues with TFLs, which is the outer side of the hip. And then also going all the way into the plantar fascia, which is why a lot of them tend to have a lot of chronic pain. It's like a whole
Yeah.
body stuff. Yeah.
Yeah. Oh, so
Yes.
you talk about the EDS body being a high resolution sensor. So
Yes.
why do people with this condition seem to be so much more sensitive to weather changes,
Yes.
smells, and certain foods like MCAS type stuff?
I think that EDS itself is not necessarily a genetic disorder, but it's more of a hereditary disorder. What I mean is that there's a sequence of genes that gets exhibited. And I think over historical time, let's say a couple hundred years ago, if someone were to have EDS, they will be labeled different things. It's like the yogis in India, and there's different oracles of different tribes and different soothsayers. So there are people that live among us, like part of my family, that are very intuitive. They can like feel things happening, right? And so that's their nature.
Yeah.
So in current day, when someone's too intuitive or feel things happening, sometimes they're called labeled like crazy or an outlier or something like
Right.
that, right? So if you actually look at historical documentation, like who actually are hypermobile? Well, even in like a lot of movies, like the movie 300, or who's hanging out with the oracles? It's so these fortune tellers that can contort and do all sorts of bendy different things, right? And so I think there's that's what I call like my superpower theory of EDS, if you will.
Yeah. Yeah.
So now there are specific gene coded to that. They have increased mast cells, okay? They have increased ability to tryptase, so they have more mast cell activation. So they have increased expression of HLA, which is histamine phenotype on their cells. But I think all that is because they kind of have this spidey sense like
Mm.
pretty much all the time, right?
Yeah.
So in modern day, if that's labeled, let's say anxiety or depression or mast cell activation, then the medicines they take inhibit that, and it's not natural. So,
Mhm.
for example, all medicines, whether it's like Benadryl or antidepressants or different types of antidepressants, they all have this property called anticholinergic property. So, acetylcholine is part of what's needed to activate these pathways. So, a lot of people with EDS, when they take these medicines, they become super like apathetic, right? And just dissociated from the world.
Yeah.
And so that's because like you're kind of inhibiting what they're supposed to be doing, which is feeling. A lot of people with EDS are big empaths. They absorb the world's emotion. And so the current way we actually look at EDS, we look at anxiety, is one that, hey, let's stifle the emotions so we can continue on with life rather than, hey, let's maybe ground the emotions with therapy, with crying, with, meditation and stuff like that, which is what we do at Texas Center for Lifestyle Medicine.
So, why does the body of an EDS patient create knots and muscle tension? And is
Mhm.
it possible that the pain they're feeling is actually their body's way of trying to save them?
Yes. So anytime there's knots of the EDS patients, it's a compensation mechanism. Okay. Usually like the upper part of the scapula, right? The rhomboids. And the rhomboids are always tense because it's trying to hold the neck back to maintain the airway, right? And sometimes they have like a lot of pelvic floor issues. And so what's happening is that we have to see these as compensating mechanisms so the body can align and regulate. Okay. There's a famous guy that figured this out in people with hypermobility. His name's Joseph Pilates. All right.
Mm,
Literally the entire field of Pilates is to look at this as compensation mechanisms, right? And if you look at what the point of Pilates does is elongation of the fascia, so you have like more sustained movements and stuff like that, right? And so and I studied Joseph Pilates quite a bit, and when he actually looked at how the fascia engages everything, he recognized there's an emotional component to it. If you're tense all the time, you're holding on to that emotion, it becomes even more tense. Sometimes with release, there's expression. Now, with Joseph Pilates, he worked with dancers. Let's express it in dance. If you're too stiff as a ballerina, there's no expression of emotion. So that's what it's all about, right?
yeah.
And we see that in a lot of like art, music, and stuff like that. So every knot is actually a compensation of something that the body's trying to protect.
So at Texas Center for Lifestyle Medicine, which
Yeah.
is where in Houston would you say that is, Cheng?
We're yeah, we're smack down in the middle of Houston near the Galleria, just north of Galleria.
Okay, the middle. It's like I'm
Yeah.
way up here north and I've been there, but I'm like, okay, if I were saying where it is. So you stated this already. You guys don't just prescribe a pill for symptoms. How does changing the way an EDS patient eats, sleeps, moves actually stabilize their genetics?
Yeah, well, stabilize their genetic expression. Yeah, so I wanna say that, like, medications in any disease state is designed for some sort of temporary relief in order to figure out something else, right? And if you're on it for a long period of time, well, you know, someone has to observe whether it's useful or not. That's pretty much all medications, and I think that's the same for EDS also. EDS itself is not necessarily a pathology, it's a pattern. So the way that we look at this is that there's no medications that can work on your spinal curvature. There's no medications that can make you breathe deeper, right? So what we want to do is all about restoration. And EDS is outside in. Outside meaning that we want to focus on the bodily functions and structure, and then we want to work on the inside. So let's say if you're anxious, and if you have EDS and then you take, neurotransmitters, 5-HTP or GABA and stuff like that, but your posture is still contracted, it's not really going to work. So we're like, hey, let's work on the outside first, regulate that, and then we can work on the inside. So at Texas Center for Lifestyle Medicine, Jenny on our team, she's our mind body medicine practitioner. So she works with people initially on simple breath work, and most people EDS can't belly breathe because their diaphragm is trapped. Working on that alone restore most of the body's nitric oxide. So decrease pause, decrease mass activation, decrease dysautonomia simply by understanding how to breathe. And then the second thing is whenever we look at brain mass, we can identify people who have really narrow restricted airways. And sometimes we'll have to get a sleep study, see if there's sleep apnea or sleep disorder breathing. Usually there is. And about a third of our population actually has daytime hypersomnia or narcolepsy, one third of our EDS population. Why is that? Is because the brain has a hard time sleeping, and that narcolepsy means that the brain's trying to like compensate, right? But the narcolepsy is often confused for ADHD because
Yeah.
narcolepsy is not like body just falling asleep and laying down. That's the movies. Narcolepsy is like spacing out for like a hot second and coming right back and say, "Huh, what just happened?" Right? And
Yeah.
then on top of that, you have cataplexy for these patients. But also, we have to educate them. If you're living in a moldy environment, which is all over Houston, exposed to that mold, sometimes there's nothing you can do until you get out of the environment, right? So if you have like illnesses, like you said, Bartonella or Lyme and stuff like that, like those have to be taken care of, right? And so we really want to have this like holistic approach to it. But also the goal is to build resilience in the body. It's not just like, "Hey, we're gonna get rid of this and fix this," because it's with EDS, it's a lifelong journey.
Yeah, yeah. So, what is the one thing that you want every zebra, all these people that are
Yeah,
struggling to know about their future? And is a high quality, high performance life actually possible with an
yeah.
EDS diagnosis?
Yeah. Oh, absolutely. In fact, my family, they're high quality, high performance. I think we have to understand that EDS is not anything that's bad. It's part of the genetic makeup. It's part of destiny, if you will, right?
Hmm.
And so the idea is to kind of honor your symptoms and see them as signals rather than symptoms. And the minute we change the word symptoms to signals, we understand. So every Monday afternoon, I have EDS and dysautonomia group. was celebrating the signals. What's your signals telling you? Oh, I'm a little sleepy today. Maybe it's because the weather's changing and it's about to rain. It's like, yeah, that's a possibility, right? And so it's understanding how your body really connects with nature, connects with
Mhm.
emotion, everything that's around you, and honoring that and not necessarily avoiding it, right? There's a
Mm.
lot of people with EDS that have like trauma, like early trauma, because maybe their symptoms weren't recognized as signals, right? Early on in life. And maybe they were kind of just pushed to the corner, maybe a little crazy and stuff like that. So we work with a lot of people on like reframing that. Say, hey, there were actually signals all along. Let's figure out what signals can we find on a daily basis and move forward with that. And that's how you can have sort of that high performance type of lifestyle.
That's encouraging for people who are challenged with this, and I'll just show you right there,
Oh, there
having
you go.
herniated several discs as a
Yeah.
very young person right before med school. And what would you say, is there any correlation with Arnold Chiari and EDS?
Yeah. Well, Chiari malformations. Yeah.
Yeah.
So the Chiari malformation, absolutely, and that's I
Okay.
think it's 2 of the 12 types that actually have that. I think Chiari is often missed. That's why we like to do upright MRIs in a lot of our patients. We work with a few surgeons, actually around the country now, that actually work with this, and there's a lot of people in Houston as well. I also think that Chiari malformation is situational because sometimes you don't even form the malformation, or the malformation may not even affect you until there's cervical instability first. And all of a sudden things get kinked and the pressure gets built up and then the Chiari malformation gets worse also, right?
Okay.
There's the cardiologist in California, Dr. Maxwell, that talked about this. I mean, he's a sleep cardiologist that talks about the concept called spiky leaky syndrome, is that the spiky is basically anything that stimulates the immune response, whether it's mold or COVID or whatever it is, will spike the immune response and histamine gets created. And the leaky is that you can have micro leakage of like cerebrospinal fluid, right?
Yes.
And we're talking about like tiny little leakages that really affect the entire body because the collagen is so lax. And Chiari malformation is sort of the more extreme form of that when things get malformed, and then that's about to happen. So definitely get that checked out.
Okay, so the program that you guys have at Texas Center for Lifestyle Medicine, you said the mind body medicine, teaching people how to breathe. And then in the groups that you facilitate, it sounds like is it a group medical visit type thing?
Yeah,
And
absolutely. Mhm.
okay. And then what about like the body work as far as the stretching and those kind of things? Do you guys
Yeah.
do that too at your clinic?
No, because we let the experts handle that. So our partnership with a company called PT, all they do is EDS and POTS, physical therapy
Uh,
and fascia release. That's all they do now. Shout out to Hannah and Camille in the Houston location. They started in Austin, and it started by Jonathan Parr. He was actually a really famous American Ninja warrior back in the day.
yeah.
And he also has an online sort of PT program. We also have our online POTS EDS and dysautonomia program as well, where
Okay.
you have an AI, you can ask it all sorts of questions and they'll help you out. And there's a bunch of different online courses. So we're making this sort of like international coalition, if you will, to kind of recognize these things, obviously because of
Yes.
my family's affected to it. Uh, and then we also want to work with different people. For example, we work with very specific dentists that do very specific things like for this population, right? And the
Yes.
body work is so important, especially with like chiropractics and fascial release, craniosacral therapy, like super important. And then one that very few people know about is myofunctional therapy, is like oral and tongue therapy, super important to keep the airway and tongue patent also. So it's a very big coalition.
Now I'm gonna pick a little bit here in that we're very attuned to tethered oral tissues
Oh yes,
and
yes,
in the pediatric population, and
yeah,
then also looking at kids doing a bite and scale. It just takes a few minutes to do
yes,
that.
yes.
And when we identify these kids with the body of the knowledge that you have, what would you encourage me as a pediatrician and then our other practitioners that are seeing children, adolescents, and adults? How can we intervene earlier to help
Yeah,
them? And what kind of things are we looking for?
yeah, also, I'm so glad you asked because, we see adults, actually, we see 13 and up, so, adolescents and up. So, here's what I wish parents knew because I have 3 daughters with this, and so we already intervened
Mhm.
early. If they're a baby, introduce solid foods earlier. All right. I
Yeah.
know there's a whole choking hazard thing, but I think it's been blown out of proportion. Introduce solid foods earlier so the maxilla can actually be stimulated.
Yes.
Uh, there's different there's different toys that they make for that, like a mile munchie and a few other things they can do for that. That's probably the most important for
Yeah.
like toddlers, right? The second thing is I'm very wary if your kid is hypermobile, like I'd be really wary of getting braces done because
Mhm.
braces stabilize your teeth, but it disallows the rest of your body to maneuver around it and your airway can get restricted. So you want to work with orthodontists that do airway orthodontists, which basically they look at your whole airway to make sure that's patent before they even do braces, or they do braces to sustain your airway, right? Big shout out to John Karakin. He's our kid's airway
Yeah.
orthodontist. And
He's
then
also
the third,
mine. He's
is he?
also mine.
Yeah,
Yeah.
awesome,
I just went into my permanent retainer, so it's,
great, yeah.
yeah, yeah, so yay, woo.
And the third one, another friend of mine, Dr. Christopher Tran, but he does like oral tie releases in his special way. Oral ties are incredibly important to get taken care of when the kids are young. If not, you can get it taken care of as an adult too. So why oral ties? So the oral ties tie the way that our fascia engages, especially the head and neck and cranial fascia. And a lot of times the oral ties will prevent relaxation in one area. It actually worsens cranial torsion, that rotation effect I was talking about, right? And then that
Yeah,
can also cause migraines, especially with temporal headaches and stuff like that, temporal occipital headaches, right? And so it's not normal for a child to have headaches. I hope you agree with that, right?
absolutely
Yeah.
100%.
Yeah, so if your
Yeah.
child has headache, that is a red flag, and oral ties and a lot of fascia ties is like one of the first things I always like make sure parents actually look at because that's a huge deal, you know? So
This
those are the three things to look at.
Yeah, so in summary, and it's so encouraging because this is where we move, is offering solids early, identifying those tethered oral tissues, kids with the elongated philtrum, the small upper
Yeah,
vermilion border, they pop out of the womb. Amy Ludeman, who is a pediatric dentist here in the Houston area, I know you've worked
yeah,
with Amy, and
yeah,
she just, kind of shared this illustration with me is that think about pioneers in a covered wagon. They gave their kid a piece of beef jerky to teeth on. And
yeah,
when you look at the teeth and the skulls of people, they have beautiful teeth.
yeah,
And, we don't chew, and it just makes me nuts when I see these kids with pouches. I'm like, no, 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 they need to chew. And then again, not static braces. We need to look at the entire airway and, teaching kids posture too. At this point, so many kids have their phone, that forward sitting posture instead of having the,
yeah.
pulling up and then
Right.
teaching him to breathe. And we have that here too, and I sometimes pull up that illustration of the fascia dissected from the tongue to the toe, and here you are repeating this.
Mhm. Yeah.
Fantastic. Where are some of the upright MRIs in the Houston area?
Oh, Sugarland upright MRI, we send pretty much everything there. They get it done
Okay.
pretty fast. Memorial Hermann does have some upright MRIs. It just takes a while to kind of get into there.
Okay.
Methodist Woodlands has it too.
Mhm.
And as flip, so there's a few areas.
Great.
But, as you were talking, I do want to add one thing. So, uh, there's an amazing dentist by the name of Dr. Ali Alkiro in Cyprus, and he does our adult EDS case. And so when you're adult, your treatment for bite is radically different. And there's something called a open loop cricket, which is actually a open loop non-fixed appliance that helps the bite hole regulate from a epigenetic standpoint. And this open loop cricket helps the body start regulating, and it can actually make the face even more symmetrical after a few weeks, which is kind of really
Mm,
cool, especially with EDS patients, because they can, even though there's torsion, you can untorse, which is kind of cool. And that's not in pediatrics. That's actually in adults. But he has his practices Innovative Smiles. If you ever want to look him up, he has
okay.
a cool little AI chat. They can talk about all the stuff, cranial torsion, EDS, and stuff like that. It kind of talks like him. And so one of the cool things is that when the appliance starts regulating the way the teeth meet together, there's instant like satisfaction. It's like, oh, people, feels good. And
Yes.
the first thing that happens is a lot of people will all of a sudden, if they have cold hands, will become warm, and you can see the blood flow come. They're like, "What is happening?" Literally with the appliance that are in there. That's one of our
Mm.
patients actually, and she's like, "I've never had warm hands in my life. Like, what's going on?" And it's because the circulation restoring because the bite is actually restored. And so for adults, there's that option also.
Beautiful. Innovative smiles. So,
Mhm.
Cheng, where can people find you? What's your website? And they will put this in the show notes.
Yeah, absolutely. So right now, well, currently it's May as we're recording this. It's EDS month, EDS Awareness Month. And so we do a lot of posts on social media. So it's my name, Cheng Ruan, MD, CHENGRUAN, MD, on TikTok and Instagram mostly. My practice is a Texas Center for Lifestyle Medicine. So we have big programs for stuff like this. For the doctors listening to this, like find me on LinkedIn, pretty active on that as well. And then for we actually are starting to make modules to teach doctors, like something that's even the dentist teaching doctors something similar to this at my nonprofit, which is the Physician Transformation Institute. Yeah.
Would you like to just tell us a little bit about the Physician Transformation Institute?
Yeah. So the Physician Transformation Institute is my nonprofit organization. So we raise funds to create ecosystems for healthcare professionals, all health professionals, physicians included. We have an app. What we want to do is we want to talk about things that are not readily talked about. So our process is called a level in process. A lot of healthcare professionals are like leveling up all the time, doing more, doing more. So we're a level in instead of level up, meaning we go like deeper and introspective. So where we bring out things like burnout and moral injury in healthcare and stuff like that. And we have like week groups. Actually, next week we have our sound bath for doctors that we have also. And so it's really to like take a chill pill, if you will, from doing the daily grind and then have a relaxed atmosphere. We can actually openly talk about these things. And we use our membership dollars to pay for anonymous funds for healthcare professionals for mental health services. So they don't necessarily have to report to the medical board if they don't necessarily want to. Yeah.
Yeah. That is a fantastic way to care for medical providers. Part of my story, I was in the Army and I became clinically depressed, postpartum, and I wasn't taught, I never got the memo in medical school that it tends to get worse with each pregnancy. And
Mm,
being in the military, you cannot take a sabbatical, you can't take
yeah.
time off, you have to declare it. And, you know, part of my story of transformation is coming out on the other side. So by you having the Physician Transformation Institute, I think that's a way to really care for other providers. I want to wrap it
Yeah.
up. I want to thank you for educating us on EDS.
Thank
POTS,
you.
dysautonomia. I've learned so much about the sphenoid sinuses, low nitric
Yeah.
oxide production,
Yeah.
the Doctor Innovative Smiles,
That's your,
and
uh,
yeah, very cool. Well, thanks for your time. I really appreciate it. This will air in several weeks, and I just want to thank you.
thank you very much. I appreciate your time.
Yours too. Thanks for joining us at Get to the Root with Hope for Healing. If this episode helped you, follow and share it with someone who needs it. And leave a review. It helps others find us too. For a free consultation, visit our website at gettotheroot.com with the number 2 and schedule a welcome call. We'll see you soon.